Approximately 10 people per day and 4,000 per year die by suicide in Canada. This figure does not include the deaths of people who are terminally ill and obtain medical assistance in dying, MAID, MAID. Risk of death by suicide differs by age, sex, and cultural group. Most people who die by suicide are middle-aged, and it is the second leading cause of death for people between the ages of 15 and 34. Many factors contribute to suicide, but it is estimated that approximately 90% of those who die by suicide have a mental health disorder, such as major depressive disorder, bipolar disorder, schizophrenia, a substance use disorder, and personality disorders. Thinking about suicide, as well as engaging in self-harm and in suicidal behaviors, are much more common than actual suicide. Suicide attempts outnumber deaths by suicide somewhere between 10 and 20 to 1. Sometimes people have passive suicidal thoughts, such as wishing they wouldn't wake up in the morning. Sometimes suicidal thoughts are more active, and people think about how they could end their lives. Having suicidal thoughts does not necessarily mean someone is on the verge of killing themselves. However, both active and passive suicidal thoughts need to be taken seriously, as they suggest something is not right in a person's life. People who think about or die by suicide often feel overwhelmed with psychological pain. This can be experienced as hopelessness, helplessness, loneliness, sadness, anger, guilt, shame, or meaninglessness. Suicide risk may be elevated among people in pain and whose chronic illnesses restrict their daily functioning, although this typically occurs when a mood or other mental health disorder is also present. Signs of suicide risk include talking about suicide and death, talking about or collecting implements for self-harm or for suicide, preparing for death by writing a will or giving away prized personal possessions, previous suicide attempts, and a recent experience or anticipation of serious personal losses. Other signs that someone might be considering suicide are similar to signs of depression. These include changes in eating or sleeping habits, withdrawal from others, extreme emotional changes, a blunting of emotional expression or loss of interest in usual activities, particularly those usually enjoyed, and neglect of personal appearance. There can also be increased use of alcohol or other drugs, an increase in strange or risky behaviors. Asking a person about suicide will not make them suicidal. It is best to come right out and say that you have noticed some changes or signs that they may be hurting or are in need of help. If the person admits to feeling sad or hopeless, ask directly if they have thought about hurting or killing themselves. Listen, don't judge, and don't try to solve their problems. You may not understand how or why someone feels the way they do, but accept that they are in pain and in need of help. Don't try to convince them that their way of seeing the world or the actions they are considering are bad or wrong. Never promise to keep information confidential. A person feeling suicidal is a person who needs help, and you may need to talk to others. There are supports and services that are effective in helping people deal with their psychological distress and recover from mental disorders. However, less than half of people who have psychological problems actually get the help they need. Keep in mind that helping loved ones doesn't mean you can or should solve their problems, treat their illness, or take away their pain. It means listening, caring, supporting, and helping them to secure the professional mental health care they need, helping to make calls and appointments, and acting as their advocate. Thinking about suicide is a health emergency that should be treated the same as any other crisis. Do not assume someone isn't serious, is being dramatic, or that suicidal thoughts will go away. If you or someone you know is thinking about suicide, cannot make the thoughts go away, feels like acting on the thoughts, have a plan for how to die by suicide, or have access to the means with which to end life, you need to get help immediately. Call 911, go to the nearest hospital emergency room or urgent care clinic, or call a crisis line or distress center. Additional resources are listed on screen. To find a registered psychologist near you, visit the following page.